More women than men are diagnosed with lung cancer in this country, and 20% of women and men diagnosed have never smoked a day in their life, according to the American Lung Association. We get the latest insight now from Dr. Duncan Savage from St. Peter's Hospital, and you are the Chief for Radiation Oncology. Thank you so much for being here, Dr. Savage.
Thank you for having me here. Thanks.
I was reading a report from the American Lung Association that found that lung cancer rates among women have skyrocketed over the past 40 years. Why?
Well, what we always need to remember about development of cancer, especially when it's due to a carcinogen, that the lung cancer or the cancer doesn't develop while that person is smoking, for example. So there's a period of time or lag time for the development of cancer, and very often this doesn't happen until 20 or 30 years after someone starts smoking and continues to smoke. So there was a big increase in the rate of women smoking in the 1970s and 1980s, and now we're starting to see some of that. And you know, what's really interesting, it seems like women are much more susceptible to developing lung cancer at lower doses of tobacco consumption as well.
And we don't know why that is, but it's the case.
It is indeed.
So, of course, you think of lung cancer and you think of smokers or former smokers, but it's not always the case. There are people diagnosed, as we mentioned in our introduction here, that have never smoked. So let's talk about the risk factors here and what some of the other reasons could be.
Yeah, so some of the other risk factors are radon. Radon is a element that can be found in some homes. That radon emits a radioactive particle, which can be a carcinogen years later. And so obviously people need to get their house tested for radon to make sure that's not present. And also passive smoke as well is a risk factor as well. But you're absolutely right. There are a lot of patients that do develop lung cancer that have never had any exposure to smoke. And you know, we are not really able to come up with a clear-cut answer for why they've developed cancer. So I think it's a misconception to think that you're only going to develop lung cancer if you're a smoker.
Right, and we do know, of course, you mentioned the secondhand smoke issue too. So, you know, if you are around smokers,
absolutely,
it's really good to encourage them to try to stop as well, because it put the whole family at risk. What about the symptoms here? Because so often it could be, you know, confused as something else perhaps that you're dealing with.
Yeah, well, one of the things about lung cancer that's so important to know is by the time you have symptoms, it really means that the disease is probably at an advanced stage and definitely more difficult to treat, and the treatment being more intense. So the key, I think, is early detection and finding this cancer when it's asymptomatic. So if someone's not having any symptoms, that's the time to find the lung cancer, because you have a better chance of intervention and cure.
Screening is making such a difference now, so let's talk about that.
Yeah, you know, so if you think about it, in the past we always did screening for women for breast cancer, men for prostate cancer, individuals for colorectal cancer, but we really weren't looking at screening for lung cancer. And this has been a relatively recent development where they did a study, and they found by doing a low-dose CAT scan on an annual basis for patients that have a risk of lung cancer, that the death rate from lung cancer went down by 20%. And this, unfortunately, has not been utilized a lot throughout the U.S. We feel this is an underutilized modality, and we really want to get the word out there. You know, one of the things that is difficult is when you take a look at the population that smokes, very often it's a higher rate of vulnerable population, or a population might not have access to health care. So it really becomes kind of a double-edged sword for those patients.
So important for you to speak up and see your doctor and say, I'm a former smoker, I think I may be in need of this screening. Also, immunotherapy is making a difference in terms of improving survival, because we are seeing some strides, thankfully, because this is a tough cancer.
Absolutely. So immunotherapy was really first used for patients with widespread cancer, and with showing some responses and people going to remission and really maybe living in symbiosis for a long time with their cancer. But now we're also testing the use of immunotherapy at early stage cancers to see whether this can be given on a preventative basis to help reduce the risk of the cancer coming back.
Thankfully, there are advancements that are making a difference in saving more lives.
Absolutely.
Dr. Savage, thanks so much for coming and talking about this important topic. We appreciate it.
Thank you so much for having me.
Of course. And you can find all of our Women's Health Wednesday segments online. You can head to news10.com and look for Women's Health under the Community tab.